I'm so excited that you guys are here to hear about this, and I'm excited to be able to talk to you guys about nutrition and cancer. So like Marcia said, I'm a radiation oncologist. I went to medical school here. I did my residency here. I stayed on as faculty here. I've been faculty at the University of Florida for 14 years now. A lot of people don't know what radiation oncology is. Most of my family still doesn't really understand it that well. So in the treatment of cancer, there's three main types of treatment. There's chemotherapy, which everyone kind of knows about. That's the medical oncologist. There's surgery, that's the surgical oncologist. And then there's radiation, and that's the radiation oncologist. And so that's what I do. I treat cancer with radiation. And I specialize in the treatment of lung and gynecologic cancers. And then I have a special interest in how we can alter our chances of getting cancer and alter the chance of cancer coming back with lifestyle modifications. And so today I'm going to talk to you specifically about nutrition. There's other things as well, and I'll touch on those at the end, but the specific focus of the talk today is about nutrition. I'll just do it this way. Nope. Marsha's on her way. And there it goes. Yeah, I think it just I needed to get on it. Okay, so a lot of my patients, when they first come to see me, they want to know, why did I get this cancer? What caused this cancer that I have? And a lot of times their sort of initial idea is that there's some genetic factors. They'll tell me, oh, well, cancer runs in my family, or, my mom had cancer, my brother had cancer, I was bound to get cancer because it's in the genes in our family. And it turns out that genetic causes of cancer, it really only accounts for about 10 to 15% of all cancers. By far, tobacco is the leading cause of cancer. About 30% of cancers are caused by tobacco, something we can obviously do something about. And then this is not really well-known data, and our medical community hasn't really embraced this or really know about this, but a solid about 30% of cancers are caused by diet, by the foods that we ingest. And if you think about it, it makes sense. Every day, multiple times a day, we're putting something into our body, and that's doing something either good or bad or neutral to our body. And so it makes sense that diet is an important cause of cancer. So what's the problem? What is it that we're eating that then leads to cancer? And really the issue is our standard American diet, otherwise known as the SAD diet. Western diet is another way of talking about this, but it's what most Americans eat on a regular basis. And so the standard American diet consists of a high intake of highly processed foods. So that means chips, crackers, cookies, things that come in a package that you buy at the grocery store, white processed flour, so like white pasta, white rice, white bread, frozen foods, fast foods. Those are all highly processed foods that we all probably, unless we're really, really diligent, it's very hard to live in the United States and not eat some ultra processed foods. Also high intake of red meats, and that includes beef, pork, and lamb. Processed meats, that's sausage, hot dogs, deli meat, bacon, all processed meats. High sugar drinks like soda, sweet tea, even Gatorade, dairy, and fried foods. And then a low intake of fruits, vegetables, whole grains, and legumes, otherwise known as beans. The issue there's a lot of issues with the standard American diet. but when we're talking about cancer, and there have been several components of the standard American diet, specifically red meats, processed meat, and highly processed foods that have actually been linked to cancer or an increase in cancer or an increase in cancer death. The jury is still out on dairy and dietary fat. There's been studies in those, and they're really not conclusive to say that consuming high amounts of dairy or dietary fat are linked to increased risks of cancer. But I think that'll come out with more studies in the future. Dairy and dietary fat definitely are linked to other chronic diseases. Okay, so in this talk, I want to really empower you guys to be able to understand what the studies show, what the science shows, so that I can tell you whatever I want, but I want you to be able to figure it out for yourselves and to really be able to understand what's going on in the literature. So I'm going to go through a lot of studies. I'm going to try and make it as digestible as possible. But just I'm going to warn you about the studies, but I think they're fascinating. So hopefully you will too. Okay, so this first one is about red and processed meats. So it's a meta-analysis. A meta-analysis is basically a study of studies. So it's a study of a bunch of different studies that all looked at the same thing and puts all that data together to come up with sort of add up all of those studies, the outcome of all those studies, and figure out sort of a better understanding of the issue. So this is a meta-analysis of prospective studies. That means studies that followed patients in real time, looking at the consumption of red and processed meats and the development of colorectal cancer. And what they found was that an increasing risk of colorectal cancer was found with an increased consumption of red and processed meats. And so this is a graphic from there. Actually, sorry. I want the people that are seeing this on Zoom to be able, or on the recording to be able to see what I'm doing. Can you guys see the mouse there? Okay, so in this graph, the y-axis is the risk. So higher up on the y-axis means increased risk of developing colorectal cancer. And then on the x-axis, it's red and processed meat intake in grams per day. So what you see here is that as you increase the consumption of red and processed meats per day, this line, the solid line, is the increase in the risk of colorectal cancer as you increase that consumption. And it sort of levels off at about 160 grams per day of red and processed meats. And I put this here just so you can get a sort of a feeling of what does 100 to 160 grams per day of red and processed meats looks like. Well, if you have a steak for dinner and maybe a couple slices of bacon in the morning, you're at, about 130 grams per day. If you have a turkey sandwich for lunch and, maybe a couple of slices of bacon or some ground beef for dinner, you're at that 160 grams per day. So it's pretty reasonable to get to that high level of red meat and processed meat consumption per day. At that top level, at 140 to 150 grams per day, the increased risk of getting colon cancer is a little over 30%. So it's pretty significant. Okay, this is another study. This is a French study. And they looked at 61,000 people, which is fantastic. That's a huge number. These are the kinds of studies that we need to be able to see what happens when you eat certain types of foods. So a huge number of people. They followed these participants in the study for about 4 years. They assessed their diet with diet questionnaires. And what they found is that high red meat consumption, which they defined as 100 grams per day, so kind of a little bit lower on that graph that we just looked at. high red meat consumption is associated with a 31% increased risk of overall cancers. And then they looked specifically at breast cancers and found it increased the risk of breast cancer 83%. So big increase in breast cancer specifically. So how does red meat actually cause cancer? There's actually multiple ways that have been studied, multiple pathways that we know red meat causes cancer. One of the ones that I think is most interesting is heme iron. So heme iron is the type of iron that is only found in animal products and especially in red meat. And that's actually why red meat has that red color. It's because of heme iron. It's only in animal products. Plants don't have heme iron. They have iron, but not heme iron. So what heme iron does is you eat red meat, you get the heme iron in your system, and that actually is a catalyst for the production of something called apparent total N-nitroso compounds. That's just a bad thing. You don't have to remember that name. It's just something bad. It causes DNA damage in your colon. This all happens actually in your colon. It causes DNA damage to your colon cells. That then leads to mutations in those cells. And then those mutations then lead to the development of adenomas in your colon, which then over time can become adenocarcinoma or colon cancer. So we know that there's a direct pathway of causation between heme iron and the development of colon cancer. Okay, another study, there's a lot of French studies. This is another French study. It's the same French study that they looked at a bunch of different ways, and it was a really excellent study. So this is specific looking at ultra-processed foods. 100,000 people, they asked about the consumption of ultra-processed foods. And the foods that stood out the most were these: white bread, packaged snacks, sodas, chicken nuggets, hot dogs, bacon, instant noodles and soups, and frozen meals. And what they found was that for every 10% increase in the proportion of the diet that was ultra-processed, that was associated with a 12% increase in all cancers, in the incidence of all cancers, and an 11% increase in breast cancer development. And this figure shows you, these are quartiles of ultra-processed food consumption. So the Q1 is the lowest consumption of ultra-processed foods, Q4 is the highest. And this dashed line is the Q4. This is incidence, cancer incidence. So the risk of developing cancer gets higher with it going up. And this is just time that they followed these participants. And so the higher quartile has the higher development of cancer, meaning the higher consumption of processed foods. So let's talk about, why is ultra-processed food cancer causing? There's a lot of different mechanisms, just like in red meat. The ones that we think are probably the most valid are, number one, processed foods just promote weight gain. They're high in sugar and fat. They're high in calories in general. They're low in fiber and micronutrients. And so you can eat a lot of them without feeling full. And so you can ingest a lot of calories. Higher calories means you're going to gain weight. And we know, it's on the CDC website, it's very well studied, that obesity leads to the development of more cancers. So 55% of cancers in women and about 25% in men are obesity related. So ultra-processed foods can lead to the development of cancer just by leading to increased weight gain. They also contain additives, a lot of chemical additives, and they contain high amounts of refined sugars. And refined sugars cause insulin spikes. Those insulin spikes increase IGF-1. That's something, it's insulin-like growth factor. It's something that is released in the body, and it actually leads to cell proliferation, which means it makes cells multiply. And that's regardless of whether they're normal cells or precancerous cells. So it directly leads to the development of cancer. A question I get a lot, and I think it's a totally valid question, is, well, does sugar cause cancer? Shouldn't I stop eating sugar because sugar feeds cancer cells? And the answer is yes. Sugar definitely feeds cancer cells. The problem is sugar feeds all of our cells. So the cancer cells and the normal cells. We need sugar, meaning glucose, for our bodies to function. There's no way around that. And even if we tried to starve the cancer cells by even not eating, our bodies can convert anything protein, fat that we ingest, can convert that into glucose. And our bodies, if we don't eat enough, can start breaking down our own muscle and fat tissue to create glucose for our bodies to keep functioning. So there's not a good way to isolate cancer cells and starve cancer cells from glucose. What we can do, though, is reduce our intake of refined sugars. Refined sugars don't do us any good. They increase insulin spikes. They definitely help, all cells grow. And so by reducing or eliminating ultra-processed foods, we can reduce our refined sugar intake, and that is definitely a good thing. Okay, going back to the study. So this is a study that looked at not just one particular food item, but looked at the Western diet as a whole. So the SAD diet, and specifically looked at the development of breast cancer. So this is a Japanese study. Looked at almost 50,000 Japanese women. They had an in-depth assessment of their food and diet, and followed them for 14 years. It's a long time to follow that many patients or that many participants. And they categorize these women into two general groups based on their eating habits. So one is the westernized diet. So Japanese women that tended to eat a more westernized diet, which in this study was characterized by eating bread, meat, processed meats, dairy products, soup, coffee, soft drinks, black tea, sauces, mayonnaise, and dressing. And then women who ate more of a traditional diet, and those were women that focused more on vegetables, fruits, soy products, potatoes, seaweed, mushroom, and fish. And what they found is that women who ate a westernized diet had a 32% higher risk of developing breast cancer compared to women who ate a more traditional diet. Women whose diet was the most westernized, they sort of looked at quartiles of the degree of westernization of their diets. Women who had the most westernized diet had an 83% higher risk of developing breast cancer compared to women whose diet was the least westernized. So it's a huge difference. And this is a really nice study because it's looking at women who are all in the same area. And over time, the Japanese diet has become more westernized. So it really looks at, the difference from a traditional diet to a progressively more Western or SAD diet. I'm not going to talk much about alcohol, but I thought it was just worth mentioning because it's something that we ingest. It's generally part of our diet in the United States. And so I feel like we just have to address it because it's an issue as well. I'm not going to give you any studies about it, but I just want you to know alcohol is a known cause of multiple cancers, including breast cancer. Breast cancer always ends up on the list for some reason. And so just keep that in mind as well. Okay, so now we know what is bad about our diet and what we eat. So let's refocus now on a better way to eat. And what I'm going to talk about mostly is a whole food plant-based diet. I'm going to show you what that means, and then also give you more studies to support why me and a bunch of other organizations are recommending a whole food plant-based diet. Okay, so what does that mean? What is that? This is the ideal cancer plate. And if you Google, you know, plates or, you know, diet pictures, you'll find a whole bunch of different pictures that look like this, where there's a plate with a different bunch of stuff on it. This is the one that I like the most because I think it's the clearest. It's from the American College of Lifestyle Medicine, and I put the link on the bottom of the page. But this is the ideal diet. This isn't necessarily what everyone's going to eat who's trying to eat for anti-cancer benefits, but this is the ideal. So you want half of your plate to be fruits and vegetables. And this is at every meal. Half the plate, fruits and vegetables. You want to drink water with every meal, or that should be your beverage of choice all the time, is water. You want a quarter of your plate to be plant proteins. And plant proteins, it's hard if you're not used to eating this way, because it's hard to think of like, well, what if I'm not eating meat, what am I going to have for protein? There's lots of different ways to get the protein in. It is a little bit more difficult. You do have to think about it a little bit more. But beans, tofu, tempeh is a type of soy product, kind of like tofu, tastes a little bit different, and nuts and seeds. And then a quarter of your plate should be whole grains. And whole grains are things like brown rice, quinoa, farro, I love farro, whole oats, whole grain bread, and popcorn. And with all of this, all of it, everything on this plate has a ton of fiber in it. So by eating this way, your fiber uptake, your fiber consumption increases significantly. So that's the goal plate. And in addition, you want to try and avoid or minimize the things that we've been talking about. So things like processed meats, animal products, most importantly, red meat. If you're going to avoid anything, avoid red meat, ultra processed foods and sugary drinks, and alcohol. I want to emphasize that even though there's an ideal plate, it's not a black and white situation. So this is where a lot of people are starting from. This is where we kind of want to get to. This is our ideal scenario. Any steps that take you from here closer to over here is good, is positive, and will improve your health. So it's not an all or none. I tend to be an all or none person. And if I can't do it 100%, then I'm not going to do it at all. And in fact, when I made my family go whole food plant-based 5 or so years ago, we did all in, and it was rough. I had some revolts at dinner time multiple times. But any steps that you can take to get over here, decreasing sweets and snacks, fast foods, just change what you drink. Move towards drinking water instead of sodas or sweet tea. And then slowly increase your whole plant foods. Start adding in more fruits and vegetables. Swap out white rice for half white, half brown rice, or half white, half farro. Those things will make a big difference, and slowly your body will get more and more used to it, and you'll get closer to this ideal plate. And you'll be a lot healthier in general, not just in terms of cancer, but in terms of a lot of other chronic diseases. So I wanted to just give you an idea of what this looks like in real life. So this is what I generally tend to eat most days of the week. I tend to be a creature of habit. So for breakfast, I usually have overnight oats with some fruit and some seeds in there also, or I'll have a smoothie. And to both of these things, I add soy protein powder just to get a little bit more protein in. For lunch, I usually have a salad with tempeh, or sometimes the legume pasta, so like the lentil pasta with some veggies. And then dinner, a common dinner that I make is roasted tofu or a tofu stir fry with veggies and brown rice, or a bean chili or tofu scrambled tacos. And then some good snacks that we turn to a lot is soy-based yogurt and fruit, nuts, protein shake. All good ideas, all good things for snacking on. Okay, let's look at the data, because I want you guys to know what the science shows. So this is going back to that French study, that original French study. So in this part of the study, they're looking at about 42,000 people. They assessed their diet and then followed them for about 4 years. And they found that a higher intake of plant products and a lower intake of animal products resulted in a 15% reduction in overall cancer incidence. This is another study. This is actually a really fantastic study. It's a combination of 2 major US studies. One was the nurses' health study, and the other one was the health professional study. So major undertakings in the US. And this, they're looking at those 2 studies combined. So it's 123,000 US adults followed for 34 years. That's amazing. This is a huge undertaking to be able to follow people for that long. It takes a lot of money and a lot of manpower. After looking at this, they defined 5 healthy lifestyle factors: never smoking, having a good body mass index, so a healthy weight, doing daily exercise, 30 minutes a day of moderate to vigorous physical activity, moderate alcohol intake, and having a healthy diet. And I'll go over a little bit more later about what they defined as a healthy diet, like right now. Healthy diet, they considered to be high in vegetables, fruits, whole grains, unsaturated fats, and low in red and processed meats, trans fats, and sugar sweetened drinks. And what they found was that just by following the healthy diet, forget about the other healthy lifestyle things, just the healthy diet reduced the risk of dying from cancer by 30%, which is pretty astounding. This is another 2 studies that look at soy and the development of breast and prostate cancers. This first one here is looking at 10,000 breast cancer survivors. Participants were followed for about a little over 7 years, and they determined their soy intake using food questionnaires, which is a standard food study methodology. And what they found was that eating 10 or more grams of soy per day was actually associated with 25% reduced risk of breast cancer recurrence. A lot of people think soy, it's bad, it's like an estrogen, it'll feed, breast cancers and endometrial cancer, it's bad for men. That's actually not true. Soy has properties that will bind to estrogen receptors, but in a different way than estrogen. So it does not act like estrogen in your body. And in fact, is actually a good thing for people with breast cancer. The second trial is a meta-analysis of 30 studies looking at soy intake and prostate cancer. And what they found was that total soy intake is associated with a reduced risk of prostate cancer. This is another study I love this study. It's the Women's Health Initiative. So it's a huge study in the United States, 49,000 postmenopausal women. And it's actually, instead of just observing the participants over time, they actually did an intervention. So they did a diet intervention. They randomized or had participants randomly assigned to one of 2 groups. One group was the diet intervention, and the intervention it lasted for 8.5 years, which is crazy. That's a long time to get people to stay on the same diet. And that diet was low fat, increased vegetables, fruits, and whole grains. And then the other half were randomized to no diet intervention. And then they followed these participants for 19 years. And what they found was I think they expected to find that the breast cancer incidence, so the rate of developing breast cancer would be lower in the diet intervention, but they found that it was lower, but it wasn't statistically significant. So they couldn't say that it wasn't due to chance. So they can't conclude that it made any difference in terms of the development of breast cancer. But what they did find was that for women that did develop breast cancer, those that were in the diet intervention group had a 21% reduction in the risk of dying from breast cancer and a 15% reduction in the risk of dying of any cause. This is, oh, and one thing I forgot to mention about this, there's this whole issue of if you have cancer already, does it make any difference? Are you already, is it a done deal? You've done what you've done and you've gotten cancer. Can you change the outcome? Can you do anything to prevent the cancer coming back? And this is one of those studies that had to show that even once you develop cancer, you can reduce the chance of the cancer coming back or of dying from that cancer by changing what you eat. This is another study specifically in people with cancer. So this is patients with stage 1 to 3 colon cancer. And they just looked at how do these people eat and did the usual food questionnaires and followed them for 8 years and found that the risk of death from CRC is colorectal cancer. So the risk of death from colorectal cancer was reduced 18% for each 5 grams per day of increased fiber. So, and that's not very much, going up 5 grams a day of fiber, but it reduced the chance of actually dying from colorectal cancer. And this graph, the straight line is the line to look at. These other dashed lines are the confidence intervals. But the straight line shows that as you increase the fiber intake in grams per day, the risk of dying from colon cancer goes down. So down is a lower risk, less than 1. So, and it doesn't ever plateau. So you can eat more and more and more fiber every day, and your risk of dying from colon cancer, once you've already got colon cancer, goes down and down and down. And then this is another study. This is 1,400 women treated for early stage breast cancer. They did diet and physical activity questionnaires. So this, they added in the physical activity component. And they looked to see, is there, does diet make a difference in terms of the dying from cancer? Does physical activity? What they found was that women with a combination of 5 or more servings a day of fruits and vegetables and moderate levels of exercise had a 7% reduction in the risk of dying at 10 years following their diagnosis of breast cancer. And so this graph shows this blue line. So this is survival. It's 1 at the top. So this is people dying off. So the higher this line, the better. So this blue line is people with high intake of fruits and vegetables and high exercise levels. They had the best survival compared to all the other categories. So even women who had high fruits and vegetables but didn't have physical activity didn't do as well as the women that did both. So how does this all work? How does a plant-based diet actually change cancer outcomes or reduce our risk of developing cancer? Like everything, there's a lot of different mechanisms, a lot of different pathways, but I'm going to go through just a few, just so you have an understanding of what's going on. The first is just the increased amount of fiber. Specifically it acts in the intestines, so it reduces the intestinal transit time, which means that you're not any mutagens or things that you're ingesting that are going to cause cancer or have the ability to cause cancer. you're reducing the amount of time that is in your colon, acting on your colon cells, because the stool is passing through faster because of the increased fiber. Increased fiber also helps your colon cells create or produce something called butyrate. Actually, that's your intestinal bacteria that create that. And that actually is huge. And this is fairly new information in the last few years that leads to lower inflammation, which then leads to cancer reduction. And then foods, plant foods have phytochemicals. So these are chemicals that are actually very helpful in terms of preventing cancer or cancer reduction. A whole food plant-based diet also works through, just like we talked about before, reducing weight, and then also reducing the amount of glucose that you've got in your bloodstream, which then reduces the amount of insulin, which then reduces the amount of insulin-like growth factor 1, which we talked about earlier, can then lead to cell proliferation and the development of cancer. So there's lots of different aspects or pathways that a plant-based diet can reduce your risk of developing cancer. I want to just briefly mention there's several other lifestyle factors that are also important in terms of reducing your cancer risk. We talked about stopping smoking, that's number 1. Maintain a healthy body weight. Exercise is hugely important. Reduce stress, that's a tough one. And then limit alcohol. This is that one study that I love that combined the 2 big US studies together and came up with the 5 healthy lifestyle factors. I only showed you the data for the healthy diet before. Now I'm showing you the data for all the other lifestyle factors. And just to remind you, it's 123,000 US adults followed for 34 years. And this is the reduction in the risk of cancer death for each of these. And then this column is the reduction in the risk of cardiovascular death. So you can see that never smoking, this is not a typo. It's only almost a 300% reduction in your risk of developing cancer or dying of cancer, and dying of cardiovascular disease if you don't smoke. And then staying at a healthy BMI, 24% reduction in the risk of cancer death, 66% for cardiovascular disease. And you can see for the others, they're all really incredibly important. Probably the lowest numbers are for moderate alcohol, but everything else, you're in the 24% to 300% range of your ability to reduce your risks. This is the same study. Their main finding was that you can actually increase your life expectancy depending on how many of these lifestyle factors you follow. So this is for women, this is for men. This is life expectancy at age 50 years. And so this is the number of the lifestyle factors that people do. And so if you have 0, you are going to live, the life expectancy is about 79. So 29 years added on to 50. For each additional lifestyle factor that people do, like exercise, maintain their healthy weight, they're adding on more years in terms of their life expectancy, to the point where if you follow all 5 healthy lifestyle factors, women can add 14 years to their life and men can add 12 years to their life. So I just want to leave you with the knowledge and understanding that you have way more control over cancer than you think you do. We all sort of think of cancer as something that just happens to us, and there's a deep sense of a complete loss of control in patients that develop cancer. But there is some control to be had. There's not control over everything, and we don't ultimately have any control over the outcome, but we do have some control. And that's through eating a whole food plant-based diet, minimize or avoid animal products, processed meats, ultra-processed foods, alcohol, stop smoking, maintain a healthy body weight, exercise, and reduce stress.